Joint popping, also known as crepitus, is a common phenomenon that can happen for various reasons. A physical therapist would typically evaluate whether the popping is a cause for concern based on factors like pain, swelling, stiffness, and mobility. When joint popping is harmless. In many cases, joint popping is normal and not a sign of injury or disease. Some common, harmless causes include gas bubbles. Cavitation occurs when gas bubbles in the synovial fluid collapse or shift, creating a popping sound. Tendon or ligament movement. Tendons or ligaments can snap over bony structures, especially in the knees, hips, or shoulders, without causing harm. Previous injuries. Scar tissue or minor structural changes can contribute to occasional popping without pain. When joint popping might be a problem. If popping is accompanied by any of the following, it could indicate an underlying issue. Pain. Persistent or sharp pain may suggest cartilage damage, arthritis, or an injury. Swelling or warmth. This can signal inflammation, which may stem from overuse, injury, or a degenerative condition. Locking or instability. If the joint feels like it's catching or giving out, it could indicate a meniscus tear, ligament damage, or other structural problems. What a physical therapist recommends. Strengthening exercises. Building muscle around the joint can improve stability and reduce excessive movement. Stretching and mobility work. Tight muscles and tendons can contribute to joint noises, so improving flexibility can help. Proper movement patterns. Correcting posture and biomechanics can prevent unnecessary strain on the joints. Medical evaluation. If pain and dysfunction persist, a doctor or physical therapist may recommend imaging, X-ray, MRI, to rule out underlying issues. In summary, if your joints pop without pain, it's likely normal. But if popping is accompanied by discomfort, swelling, or instability, a physical therapist can help assess and treat any underlying issues.